The baby teeth are not as strong as adult teeth, and they often get cavities. And what cavity is a disease. So we have bacteria inside, and this bacteria transmits into the adult teeth. So when the baby tooth sheds and adult tooth erupts, you can get a cavity in a newly erupted tooth. So it's very important to fix the baby teeth before they become problematic for the adult teeth. This is very common that the children come in and they're very scared, and I can see them shivering and they're faint looking, sweating, and a lot of symptoms, and they're in pain, they couldn't sleep overnight, and they're agitated, and the parents are worried what we're going to do about it. And I give them every right to be anxious because the child is in pain, and we have to address that appropriately. So a scared child is very common. We will normally give them some pain stop beforehand, and we'll see them for an initial consult. We'll chat to the parents, we'll put them at ease, and we'll talk to the kid, and we'll address the main concern. And we'll put them on happy gas, so they will be relaxed and calm. And once they are relaxed and calm, then we can start the treatment, have a look to see where the problem is, and mostly the problem is not as bad as they think, and we can easily fix the problem. So once we identify the problem, if the problems are a lot of decay, or if the problems are overwhelmingly difficult, say the patient is uncooperative and they're moving a lot, they're not really listening, and they're crying and they don't want me to do anything really, then we have to think of getting some other modes of treatment, such as sleep dentistry. So we will refer them to a specialist pediatrician who can look after the child a bit better. So they put them to sleep and they provide all the treatment that is required, and then send them back to me for a final assessment and preventive treatments. Children's dentistry are relatively inexpensive. So on the contrary to what people think, that's going to cost them a lot of money on baby teeth, which will fall off and eventually going to go to waste, it's not true. So children's dentistry is one of the most effective way of keeping the teeth, adult teeth, for life. And with a new government subsidy of $1,000 that's worth for 2 years, for children between age 2 and 17, we can provide any preventive treatment or other treatments as per required for the children, and that will be bulk billed through the Medicare if the parents are eligible for this kind of treatment. I'd say the best time to see a dentist is as soon as the baby teeth erupt. So that would be normally the lower front teeth, and when they come out, I'll get the child in and I'll show them a toothbrush, show them how to clean the teeth. We'll show the parents a little video on the computer and tell them what to use, a low-grade fluoridated toothpaste for children and a baby toothbrush, and we show them the technique, how to look after the teeth, and we give them some oral hygiene instructions. And what happens is, if the parent bring the children in early, we can prevent any problems that may occur in the future. We have a child-friendly environment here, and all my staff are trained and friendly with the children, and they all love child. If they didn't choose dental assisting for profession, they would be in a childcare center. They're very friendly and approachable, and that's one of our mottos. The other benefit would be the use of happy gas. So happy gas is putting the child at very relaxed and calm manner. Even the most active child will be lying down like a little sheep. So I like that. So it makes me work efficiently and puts me at ease as well. The other thing that we offer is free consultation for parents. if they bring their children for the child dental benefit scheme from the government. So we look in there and see if there is any problems and let them know in advance of time. So the benefits are for everyone. So we're focusing on family dentistry and making everybody happy. The other thing we do is a cavity prevention treatment, which involves a high concentrated fluoride, which we apply to the baby teeth, and this will ensure the teeth will become stronger and last much longer and won't cause any problems for the child. Normally, this treatment will cost $150, which will be provided upon completion of the treatment for free for our patients.